goodness. All right, welcome everybody to another Zoom call. A number of questions came through, so that's good. Just a reminder to check the members only site for announcements. And another reminder that you can all get on any of our courses. So make sure you check as well. All right, so let's jump into some questions here. Very small computer screen, so I gotta move this around a little bit. Which berberine would you suggest for me to add to my protocol? And how many a day is the question. Which berberine to add to the protocol and how many a day? Let's see if I can get to it. Oh, my computer screen is so small. Let's see if I can get to it. Here we go. All right. So you guys can see that it's really small, but apologize. The Berber Clear is our private labeled berberine. It's a Designs for Health berberine. And the reason why I like it is it's got berberine and ALA, alpha lipoic acid, in it. So that's what makes it so good for cancer patients. So Berber Clear in at 3 per day, and try to split it up as best you can. I know some people are like, oh, I'm not very good at splitting up my supplements. Well, then take 2 in the morning and 1 in the evening. If you can split it up morning, lunchtime, and dinner, that would even be better. I know it's hard for some people to do that. It's hard for me to do that. Berber Clear is the better berberine. It's a great berberine. How long do you have to wait to take supplements before your blood work, or does it not matter? It doesn't really matter at all. So your supplements shouldn't affect your blood work really at all. So when you're getting just a CBC or a complete metabolic panel, or you're getting full testing for food sensitivities or anything, your supplements, taking your supplements right before you do your blood work, it literally has no effect on your blood work. I have not seen anything about supplements that affect on your blood work, so you don't have to worry about that. The only thing I will say about blood work is that it's always best to do a 12-hour fast. So I know sometimes that's just not convenient. You're going in to get a blood test at 4 o'clock in the afternoon. You would have fasted all day. A lot of the blood markers, a fast really makes no difference. It does make a difference on your glucose levels and some other factors, some other markers as well. Definitely your glucose levels. Now, with the advent of home glucometers and people that have a home glucometer, your glucose level on your blood test on a CBC makes little you're not really looking at that. Then if you're able to measure your own glucose levels throughout the day and post eating a meal and things, so it's not as big a deal. But typically it's always better to do a 12-hour fast before you're doing any blood work. So you'd want to schedule, in a perfect case scenario, schedule your blood work to go in at 9 o'clock or 8 o'clock in the morning and you get your blood work and you haven't eaten since 8 o'clock the night before. That's going to be your best thing. That's going to be your best picture to get your blood work. Another good thing to look at when you get blood work done is that you do it at the same time each time you do it. So if let's say you're getting blood work every month or every 3 months or every 6 months, you try to schedule it at 9 o'clock in the morning every time you go to get your blood work done, and you do a 12-hour fast on each one. You're going to get just more accurate comparisons. Do you have any objections or comments on the treatments proposed for me at the Immunotherapy Institute in Tijuana? So this person sent me a proposal from this Mexico Cancer Clinic in Tijuana, what they want to do for her. No, I think it looks great. And if you feel led to go down there and do that, there's a lot of different, semi-invasive therapies that could be really great. So I looked over it thoroughly this morning, and I thought it was a great fit. So Do I think for you specifically, is it necessary where you're at right now? Um, no, but I mean, again, if you feel led to do that, then by all means do that. I don't know if you made the step to talk to the surgeon yet, if you had that appointment, whether that, how that went, whether they're going to do a lumpectomy or they're still pushing you for a mastectomy. Um, I don't know. So um, if they're if you're planning on doing the Tijuana visit prior to that, or are you going to go do the surgery and do the lumpectomy, or are they pushing you for a mastectomy? I don't know. Um, so, um, uh, but I did like their proposal. It looked great. Do I think you particularly need to do that? No. But if you feel led to that, I don't see any problem with that whatsoever. I have not received any information on my genetic review as of yet. So um, this person who sent this is not on the call right now, doesn't look like. Um, and please check your email because I sent out your genetic information. I looked 2 days after Christmas on the 27th. So please check your email. I sent you out all 3 reports in 2 separate emails. So you should have that by now. So, I checked to make sure the email went through. The email did go through. It might be in your spam folder, maybe, but look in that and make sure you got that. Your recommendation for my tumor growth was a minimum of 15 capsules of Digestimes Plus in the morning and the same in the evening, 30 minutes away from food. So understand that protocol. That is Dr. William Kelly's protocol for enzyme therapy. So enzyme therapy for cancer is to be taking high dose of pancreatic enzymes that you would take on an empty stomach. So high doses of pancreatic enzymes on an empty stomach so that you absorb them. And the idea is that the enzymes can help break down the cancer and the slime layer around the cancer so that your immune system can better get at it and attack it. Now, Dr. Kelly's protocol is really best for cancers of the intestinal tract, cancers of the pancreas, cancers of the liver, and maybe bile duct cancer. That's where it really shines, is those types of cancers. Certainly, it's a therapy that should be attempted by anybody if other therapies are not working. The reason why I say, well, why don't you just jump into that right away? You can't. The negative of it is that you're taking so darn many pills. We're using 15 to 30 Digestimes in the morning and in the evening, and you have to take it about 30 minutes away from food. And you can see in this person's questions, I do not get up till about 2 p.m. and go to bed at 9:30. I have a smoothie around 10 a.m. in bed. I took 15 enzymes around 9 a.m. and threw up a half hour later. That's not uncommon. That's a problem. So stomach was queasy for 5 to 6 hours, ended up staying in bed even longer. The next time I took 4 of them about 7 p.m., my stomach hurt for 4 hours. The next time I tried to take 2 and I could still feel it in my stomach, but it was tolerable. Help. You have to work up on it. This is an issue. So Dr. Nicholas Gonzalez, who was one of my teachers, taught me about Dr. Kelly's protocols. He was very big into Dr. Kelly's protocols, and he actually wrote several books on Dr. William Kelly. I had long discussions with him about Dr. William Kelly. I highly admire him, but a lot of people can't do it. You realize that the pills, the pancreatic enzymes that they had at the time, and that Dr. Gonzalez was using 15 years ago, were at a dosage that he had to have people take 75 pills in the morning and 75 pills at night before they go to bed. I don't know how anybody could swallow 150 of those pills a day. Plus, they were taking other supplements. I just don't know how people could do it. Well, the truth was, a lot of people, there's just no way they could do it. It was a pretty minimal amount of people that could do that. Now, with the advent of the fermented Digestimes Plus, which is so much higher dose per capsule, we could get by with taking a lot less of them. The problem still exists, as in this person's questions, an example of this person's questions. One thing that you could do is you could open them up and put them in the smoothie. It could be actually the capsule itself that is causing stomach upset. That's very possible that it's the capsule itself. So I would try two things. If you're like, oh, there's no way I can open up these capsules, then I would start really small and start with 2 in the morning, 2 at night. If you can open up the capsules, I would start opening up and maybe start with maybe 3 or 4 in your smoothie in the morning and 3 or 4 in some type of smoothie drink in the evening. Well, you're supposed to take them away from food. Can I take them with my smoothie? Yes, take them with your smoothie. You'll get some of the enzymes wasted digesting the smoothie, but you're not eating a whole meal and having them wasted that way. That's the way I would do it if I were you. I want to address this question that came in here. Curious on why you think the MX clinic is unnecessary. Is a lumpectomy easier, cheaper, better? P.S. The surgeon hasn't called me yet. Yes, I don't think that going to the Mexico clinic is going to be a replacement for the lumpectomy or the mastectomy. I just don't think that that's going to happen. I don't think going to the Mexico clinic is going to make this shrink to disappear down to zero. Anything's possible. God can do anything, but I don't think that it will. And I know you're interested in trying to save your nodes. It's if you have the ability to go down there and do it, and your surgeon still hasn't even called you yet, and you can get down there and do this and try this and see if you can get even more shrinkage, by all means, go for it. I'm all for it, 100%. All right, this question. I'm interested in running a short Rife program prior to my nightly cancer program. How do I set up the system before going to bed so that it will run 2 sessions in sequence without having to wake up to launch the second program? This is what is called program stacking. So I have a video on the Rife section about stacking programs. I'll look and make sure. Mike, in his True Rife videos, has a video on stacking programs. I don't do that. So I can't remember off the top of my head how to do that, but it's really a simple function, how to pick a program, and then you pick another program, and there's some things that you do on the Rife thing, on the Rife program, and you stack it and you hit run, and it'll play the first program and then it'll play the second program. And it's very simple. I think it's about a 4-minute video on how to stack programs. I'll find it and I'll put it up on the member site if it's not there already. It's called Stacking Programs. When I do my foot bath, I am getting slight pain in my liver area. Is it possible that there is still cancer in this area? Is this good or something to be concerned about? I don't think that when you do the foot bath, getting pain in your liver area is suggestive that there's still cancer in the area. I don't think that is a correlative suggestion that you could make any type of stretch of diagnosis with that. Whenever you have pain doing a foot bath program or a Rife program, it could be just because the frequencies are affecting that area some way. And this is where I created that video, Good Pain versus bad pain with cancer. It's almost always when you are running a Rife program and you feel a little tingle or you feel a little pain anywhere in your body, almost 100% of the time, it's a good pain. It's a good thing. Those frequencies are affecting that area, and that's a good thing. So I do not think it's suggestive that there's cancer there. It could be just your body's just pulling the garbage out of your liver. It's helping stimulate detoxification pathways. The only way to know if there's cancer there is to do a scan or some sort of medical procedure to look at that again. Are you familiar with the emotional code? So the emotional code is a book that's out there, and they have a website, and there's different tapping things that you do with the emotional code. It's part of what was it called? Emotional Freedom Technique, EFT. So emotional code stemmed off of emotional freedom technique. For people looking for help with emotional healing from that could be attributed to their cancer. If so, do you think this is in line with Christianity or something outside of the Christian faith? No, I don't think it's outside of the Christian faith. I don't think this is. I read the Emotional Code book years ago. I used to teach some EFT. There's nothing New Age about it. There's nothing, anti-Christian about it whatsoever. It's literally tapping on different acupuncture points to stimulate different changes in your body and how you're neurologically connected to an emotion, because you talk through a blockage in your emotions. So take a step back from a neurological perspective. If let's say, okay, let's use this example because everybody's probably experienced this. I remember when I was a kid, my sister made these homemade ice cream sandwiches. She made the cookie part, and then she got some ice cream, and she made these ice cream sandwiches out of these cookies, and she froze them. They were delicious. I had one of them, and then I ended up getting the flu. I don't know. I was like 10 years old, 8 years old. I ended up getting the flu and I got sick. And then I got it stuck in my mind that I will never eat one of those ice cream sandwiches again, because it was right after I ate those ice cream sandwiches that I ended up picking up this bug and I got sick. So was there anything physiological about that ice cream sandwich that made me feel nausea thinking about eating an ice cream sandwich? Is there anything that sickened me because of that ice cream sandwich that caused my sickness? No. So it was all an emotional tie. And from a neurological perspective, your prefrontal cortex makes neurological connections with a deeper part of the brain called the amygdala. So that just stimulated this amygdala connection. So every time I saw an ice cream sandwich, my brothers and sisters were eating one of those ice cream sandwiches. A week later, oh my gosh, I just felt sick. I had to go in the other room. I couldn't even see them anymore. Now, again, nothing physiological about the chemistry of that ice cream sandwiches. It was physiological in my brain on the neurological connection of my prefrontal cortex viewing an ice cream sandwich and firing back to my amygdala this emotional, deep-seated emotional pain that I had because of being, violently ill with the flu. So it is with so many things of our life. We end up having these prefrontal cortex. That's the frontal part of your brain that is your coordinator of your brain. It's the executive of the brain. You view something and then you decide what that thing means to you based upon past experiences. And if you had a deep-seated emotional experience with that thing, that is rooted in that deep part of the brain called the amygdala, and you could have a violent reaction when you view that thing. Same thing if you were in a bad car accident. Same thing if you could. There's a zillion examples of this, and you probably have thought of some while I'm telling you my example. Well, using techniques like emotional freedom technique and the emotional code, it's simply stimulating different points on your body while you're thinking of that thing to help break that neurological connection in your brain. And it really does work. Um, I remember a gal who was a patient of mine. This is probably 20 years ago. And she was in her late 50s at the time. And she came to one of my, I used to have these weekly seminars and I was teaching on emotional freedom technique. And she said, I have to go to the dentist tomorrow and I have to get knocked out every time I go to the dentist because I have this fear, this deep seated fear of dental work. And we literally did emotional freedom technique. So she kind of volunteered to be the example of this. And she came back the next week. She said, I went to the dentist. I did not have to get knocked out. I was able to get Novocaine. I did the whole dental procedure and it was just amazing. And this is since I was just a little kid because she had this horrible experience with the dentist when she was like 7 years old. So this stuff really does work. Things that, how our neurological connections in the brain fire back to deep-seated emotional experiences are real. And you can't belittle those things. Um, Now, the psychiatric profession just medicates people to numbness so that they don't feel those things. Well, I guess that can work too, but how bad is that for you? Using things like the emotional code and emotional freedom technique can be very beneficial. And I don't think, I studied a lot of this stuff. There is nothing anti-spiritual about them. So the people, maybe there are people that teach this stuff now that are way on the new age spectrum. Don't discount that. But in general, the procedure is just straight physiology. It's nothing wrong with it whatsoever. I'm glad this person asked this question because I keep forgetting to talk about it. So there seems to be a lot of concern about the recent purchase of TrueRife. So TrueRife was purchased by a doctor out of Texas um, and another guy, friend of his out of Texas. Now, I didn't know about this till about 6 weeks ago. The purchase actually went through about 3 months ago. And Mike, who owned TrueRife and started TrueRife, is still with the company, and he'll be with the company for another 3 months or so. And he'll always be available to communicate with, so the company has if the company has any issues. Well, I had called Mike to ask him a question about something about 6 weeks ago, and he said, "Oh, here, I want you to talk to a doctor." I'm sorry, I don't remember his name. You could look up TrueRife. They just put up a brand new website that's much nicer than their old website. And the doctor who owns it is got a little biography on the website, so you can look at it. I can't remember his name off the top of my head. So I was able to chat with that doctor for about, I don't know, half hour, 45 minutes, and to chat with his partner, who is going to be mainly the managing director there, doing what Mike did there, handling all the everything that is going on. Understand they're retaining all their other employees and nobody's getting let go or replaced. So I was shocked to begin with. Mike didn't even tell me that he was selling the company, but it came out of the blue for him too. So later he talked to me about it, that he was thinking of selling it. He's in his, mid 70s, and he's like, I got to move on, in my life, and I'm just ready to retire. And this guy came out of the blue and offered to buy the company. So after talking to the doctor who's buying the company for about 45 minutes, I was very pleased. I think the company's going to go in even a better direction. So, um, if any of you have talked to Mike at TrueRife over the last couple of years, he's the nicest guy on the planet, right? He's a nice guy, but he gets really crabby too. So, especially if it's been a long day and he's been dealing with a lot of people that are crabbing at him, he gets very short fused. And we've gotten complaints from our patients, members, about how they were treated by Mike at times, and we got great compliments how people love Mike. So it really depended on how you caught him. Well, he's been super happy for the last 3 months because he's going to be moving on in life. So I think they're making really good positive changes. The owner of the company, his wife is a triathlete. They are very, he's a medical doctor, but he's a very functional medicine doctor um, from uh, from Texas, and they want to move the company in a direction where they're gonna make it their the True Life more available to athletes and people that just want to stay healthy, which is exciting. Now, I do know the price of all their stuff is going up just because the price of their components are going up. So that isn't an issue. I think the company's going to go in a very good direction. So I'm not a part of any of the Rife Facebook groups or Discord groups. So I don't know what people are saying about it. Um, I got nothing but positive. I think it's going to be really good. I do know their prices are going to go up 5 to 7%. I think starting January 15th. We're not changing any of our costs or our prices, but it is it price of everything's going up. I mean, yeah, it just is what it is. But no, I'm very positive about it. I was like blown away when I first heard about it. I thought, oh, great. But no, I'm very positive. I think it's going to go in a better direction. Um, when I first, Mike was very inventive and doing new things. I think this company's even going to go, this owner is going to even go farther. I think I'm really actually excited about everything and what's going on. So, okay, back to your questions here now. Is far infrared sauna okay if my kidneys feel like they are struggling a bit? Yes, I think far infrared sauna is very okay. Make sure you're drinking lots of water. That's my only thing. You don't want to be dehydrated. Dehydration on your kidneys is the hardest thing on your kidneys. So make sure you're drinking a lot of water. I did um, OT for 2 consecutive days and sweat a lot. Third day, felt like my kidneys were struggling a bit. I've been drinking lots of lemon water and added some trace minerals and electrolytes. Also, can trace minerals and electrolytes cause kidney issues? So I don't know which trace minerals you're talking about. If you're talking about trace minerals that are the liquid trace minerals, throw them away. Don't use those. Use the Albion trace minerals, like our brand, the Clear Multimin Plus are my favorite ones, or our Clear Multimin. Use those trace minerals, not a liquid trace minerals. Liquid trace minerals um, are elemental minerals, meaning like right out of the ground, and they don't do well. You don't absorb them well, and they're hard on your kidney. So don't be taking those. I spoke about the right form of minerals a while back, and you want to be making sure you're taking minerals in the form that they were created to be consumed in, which would be plant-based minerals that has a double bond amino acid. The only ones that you can get that way are, they'll say Albion or Trax on the back of the bottle. They are not a liquid product. They are a powder product. Could be an issue with too much oxalate in my system. Well, yeah, but if you're drinking lots of water and you're flushing out your kidneys, the sauna is really, really good for you. Doesn't matter if I use medium roast or light roast for my enemas. No, they don't work exactly the same. So the light roast, the golden roast that we sell in our store is specifically for enemas. You wouldn't drink that. It's not roasted very much at all, because the lighter the roast, the more caffeine in it, the more it's going to stimulate the the parasympathetics. Now, again, if you're doing my easy peasy enema, prescription that's on the membership site, you're just just roasting any coffee, is just, hey, that's better than doing nothing. So don't get too hung up on that. Don't beat yourself. Oh, I gotta get this. This is going to be the magic secret, is gotta get this light roast. No. So if you're just doing the coffee enemas, I don't care if you're using Starbucks. Okay, so no, don't use Starbucks, but use an organic blend would be best. I had to get off my vegan diet a month ago because I was losing too much weight. Got down to 94 pounds. That's not good. I'm 5'1.5" I'm having a problem eating food as I am scared to eat anything. Don't be scared to eat anything. I was eating peanut butter and banana sandwiches all day as it calmed my stomach. How do I change my mindset? It's mostly psychological, I'm sure. Yes, I would say so. You gotta chill out about your diet. Remember, we say in your binder, your diet is just your diet. It's a guideline. It's not a religion. Okay, so it's not going to be a make or break thing. So eat. You gotta eat some food. You gotta get your weight back up. Start enjoying it. God gave you this food to eat. It doesn't mean you go and eat a McDonald's hamburger, but just eat some food. Enjoy food. It's read the book of Galatians and don't beat yourself up over your diet. Okay, you're not a Pharisee. Don't act like one. I sent you several questions from the website form at 2:30 Central Standard Time. I put them here right now. Sorry if they're too long for the chat, or maybe you want to look at them. Did you? I'm sorry, I missed your question then. Got my tumor markers run again, but had to go with LabCorp November 10th and Quest December 29th. Okay, so let me just chat on that really quick. You can get different readings from different labs. So that's just, they have different instrumentation. You could even get different readings from the exact same lab. If you were in the hospital and you got a lab done and you got a lab done again in the hospital, 5 minutes later, you can get a different reading because they're counting white blood cells and such. It just is a different lab technician and it can be off. So certainly with different labs, you can get different readings. All right, not sure how to interpret these results compared. Been doing Connor's Clinic program for ER plus breast cancer since October 16th. My results, the CEA, November, in November, 1.8, in December, 1.3. CA 19.9, November, less than 2, less than 3. So this is the CA 19.9 is basically a mute point for you. The CEA is within normal range for you. CA 125, this one, it seems I got closer to the upper range, 32 and 37. Again, even if this is the same lab, a difference from 32 to 37, that's still within the margin of error there. So I would even be concerned about that. CA 15.3, 29.8 to 22. Well, you're starting to go a little bit beyond the margin of error in the good direction, so that's good. See the difference in what different lab calls normal. 0 to 25 was LabCorp, and Quest is less than 32. Just a little bit different range difference because there's nothing set in stone with ranges. How do I read this since one went up and the other went down, but they're all still within normal range? You're still doing I'd say you're doing great. You just don't want them to spike. So what you're looking for, let's look at the CA 2729 as an example. This is really the only one that well, this one and the CA 15.3 that you can really use as markers because they're the only ones that are close to being outside of normal. And you see even the 29.8 would have been within normal range on the Quest lab. Because these normal ranges are not set in stone. They're just something that, lab that the medical profession has picked over a period of time that this is within normal range. It's just like when I graduated back in the 1980s, normal cholesterol was, if you were abnormal, if you were over 250, then they dropped it down to 220, then 200, and now it's 180. Why? Because they can sell more drugs to Lipitor to people if they drop the normal down. Yeah, I'm sorry, it's cynical, but it's true. How do I read these? I'd say you're looking for changes. How you read your labs, you're looking for changes, and you're looking for fairly dramatic changes. So a change from 32 to 37, oh, that went up. Yeah, well, it's still kind of within range of what you'd think is not really a jump. You're looking at if you had a jump from 32 to 58, okay, that's a jump. That's what you're looking for, gross changes like that. So another word on tumor markers, it's like, okay, you have a tumor marker of, let's look at your CA19-9 of less than 2, right? That means it's normal in people with even no cancer to have a CA19-9. If yours was 25, 0 to 35 is normal. So this isn't specifically telling a person that they have cancer. You can have this enzyme marker even if you don't have cancer. So that's why they're just markers. They're not definitive diagnostic tests. They're just markers. They give us clues. So when you look at these, you run them first to get kind of a baseline, and now you're looking for major changes. So what you'd be concerned with is if your CA 15.3 was 29.8 back in November, and now it's 74 in December. That would be a red flag concern. Okay, is there anything else I could do to be more aggressive? There's positives and negatives to being super aggressive too. So no, I think you're going in the right direction. Keep going in the right direction. And to answer your question, I know you and some other people have concern about, well, I can't do cheek swabs anymore. How am I going to know I'm going in the right direction? I'm trying to work on a workaround with that. I'm out of the office this week. Next week, when I get back in the office, I know a number of you sent in possible days of doing a protocol Zoom, and I'm trying to work on a workaround to keep us legal and looking at protocols over a Zoom in an educational format that we can stay completely legal. So. Hi, Dr. Cutters. I emailed a copy of my labs to the clinic. My alkaline phosphatase is trending up, but is still within range. Would now be a good time to reassess my protocol. Yeah, let me look at that. I didn't see those labs. Hold on while we're talking here to let me see. Who you emailed that to? Can you email that again? I don't see it in the emails at all. So can you email that again to info at Connors Clinic, and then I'll look at that again. If you're still within normal range, let me look at it again and I'll let you know. All right, I guess my question didn't go through. My Dutch results showed low methylation. You said it's not a problem. Oops, where'd it go? You said it's not a problem unless homocysteine is high. I just did that test and it came back at 21.3. Yes, that's high. We need to add some methyl groups. So it's nothing's ever simple, but honestly, it's a fairly simple fix. The question is, do you have the methylated B vitamins at home? So let's go to this slide here. So methylated B vitamins would be 5 methyl tetrahydrofolate, or it would be or I should say methylcobalamin. If you have those products at home, so 5-methyl tetrahydrofolate is your methylated folate, and methylcobalamin is your methylated B12. We just want to start taking some of that. And you should start at, make sure you're taking, I would say, less than 1 gram of this per day. So if it's 500 milligrams or 1,000 milligrams, don't take any more than that. There are some supplements on the market that are like 5 grams of methyl tetrahydrofolate. Do not start with something like that. Taking too much methyl tetrahydrofolate will push a different pathway called the biopterin pathway really, really hard. And if you have any defects in the biopterin pathway, you're gonna have some emotional issues, because you could create way too much serotonin. That's the most common thing. And then you get some rage issues. And we don't want you beating anybody up or hurting your spouse. So methylcobalamin, there's really no upper limit on this, within reason. So any of the supplements that are out there with the methylcobalamin, just follow what's on the bottle for that. But make sure you're not taking any more than 1 gram of the methyl tetrahydrofolate. What is the new TrueRife website? It's the same. It's truerife.com. So the website was down last week because they were rebuilding it. It just looks much nicer. So they had the website completely just redone, which needed to be refreshed. So it looks really nice. I just went to it just half an hour ago, so it is working. This one is for Tony. Again, I did send the form. Sorry, I didn't see it. For the squamous cell cancer on his tonsil, what is the best scan to follow up with to gauge progress? You really want to do scans on based upon what was done before. So you want to compare apples to apples. So let's say you did an MRI before, and you want to see progress, do another MRI. Or if was it a CT, and that's what they showed the size and such, you do another CT. But the question really is, why? Unless you're going to do a medical procedure that they're going to recommend, but I'm not saying you shouldn't, but if you're considering doing radiation or chemotherapy, then by all means, best to compare apples to apples, best to compare the study that showed the size and diagnosed the size and measurement of it before, to see if you're only doing this for curiosity's sake. You have to ask yourself the question why, because there is invasiveness to an MRI. There's certainly more invasiveness to a CT scan with the radiation, but there's still invasiveness with an MRI. So if he's swallowing better, what you're saying, then I would say continue your road that you're going right now, unless you're considering doing some sort of other standards of care. Not sure if the cancer is spreading. I know only a biopsy can be 100% diagnosed. Want to poke more holes into it? Yeah, I totally agree. Is there a time to consider conventional treatments? Yes, I do think there's always a time to consider. I think you should consider it all the time. But again, that's where you're praying about your decision and asking God to, hey, do I need to do something else? And again, maybe God's going to lead you to do something else. I've said this 100 times before. If God wanted, me to do chemo for the sole reason to witness to some chemo nurse, I would have done it. But in my prayer time and prayer life, prayed about what I should do. I just felt like that he was not leading me down that pathway. So, um, and you don't want to be, I've said this 1,000 times before, you don't want to be dogmatically positioned like, I would never do chemo ever, ever. I just don't think that's wise. I mean, you got to be open to being wise in your decision. I've seen patients that did chemo, and that's what saved their life, is doing that chemo. Maybe they didn't have to follow through with every 6, sessions or 12 sessions, but doing a little bit helped knock it down. And I've also seen people that got frightened into doing something like that. That was their demise. So let fear, don't make any decision based upon fear. Don't make a decision based upon being dogmatically positioned either. Say, hey, I'm going to do what I need to do. I'm going to use wisdom, but if I move it in the right directions, then I'm going to keep moving in the right direction. So I got full blood labs in June, and then in December, total cholesterol, good. So let's little chat on cholesterol. I've talked about this a lot before, but one of the worst things for a cancer patient is having low cholesterol. So cholesterol is your precursor for vitamin D. As the sun hits your skin, it changes a chemical in your skin called 7-hydroxycholesterol, which is derived from circulating cholesterol. So one of the dangers of people going on Lipitor and cholesterol lowering drugs is that they end up with a vitamin D deficiency because they can't convert the vitamin D that they normally get from the sun, into vitamin D. So they don't get vitamin D from the sun. Besides the fact that Lipitor damages your liver in so many ways too. HDL is down. LDL, still about the same. Glucose, yeah, you're still fine in glucose range. A1C, great. Insulin, fantastic. Alkaline, I think that's alkaline phosphatase, AST, ALT. So everything else is looking great. High sensitivity CRP is really a function of inflammation. C-reactive protein is really the breakdown of inflammatory cytokines in your liver. A few years ago, they came out with a test called the high sensitivity CRP to try to get more specific on cytokines that could be affecting your vascular system. But it's really not that specific. Everything else looks good. Yeah. Ferritin. I wouldn't be concerned about ferritin. When ferritin is really high, it's actually an inflammatory marker. So everything else is great. All right. T3 low. If the only thing that was done is your TSH and T3, it's not a complete thyroid panel. So you'd really want to get a T4, T3 uptake, reverse T3, TPO, um, uh, antibody test done too, to really get a good picture of T3. T3 and TSH can change throughout the day and day by day too. So that's not enough to diagnose thyroid issues. Regarding the methylation, since you said I'm getting lots of natural methyl groups in my diet, heavy in greens, should I be looking for root causes? No, I would not. It really has to do with your genetics. There's not really any other root causes of lack of methyl groups, but your genetics, your MTHFR gene and your MTR and your MTRR genes are really your root causes. But again, even if a person has those genetic defects, doesn't mean they're going to have major issues, but certainly it predisposes to them to that. And if you did not have cancer, I probably would put you on methyl groups having those defects. So I think it's time to just go on that. Can you say the email for labs again? Info at Connors Clinic. Send them to that. INFO at CONNERS clinic.com. If you send it to CONNORS, it will not get to me. So, yep, you can still email the labs and we can talk about we can make the other Zoom call a labs protocol thing. And I'm actually coming out in January, going to I'll put out a whole bunch of videos on interpreting labs for you, which I think will be beneficial. I'm going to go through the CBC, I'm going to go through a complete metabolic panel and a whole bunch of things and just break it down into real good usable data. How soon to retest homocysteine? I'd go 3 months. So why the rise when my diet is higher in methyl groups? Well, I don't know. I mean, your diet is higher in fiber and other things too, so you might not be, absorbing as many methyl groups, and you may have been eating, fairly well beforehand too. So, which measurement is more accurate, MRI or ultrasound? It depends on what you're trying to measure. So, okay, so let's say if you go in, okay, here's a perfect real life example. Somebody told me the other day that they were having upper right quadrant pain. This was not a cancer patient, and they suspected gallstones. They had history of gallstone issues. Went to the ER and they did a CT scan, and they said it's not gallstones. Maybe you have an ulcer. That's what they said, and they sent her home. And this person said, I've had ulcers before. This isn't an ulcer. It doesn't feel like an ulcer. And they just said, well, we don't know. Okay, CT scan is not the test that you run for gallstones. Ultrasound is the test for gallstones. Why did they not do an ultrasound? It's far less expensive. I hate to be so cynical, but her insurance probably covered a CT scan, and they made a whole bunch more money on a CT scan. Oh boy, it's just ridiculous. So depends on what you're looking for. So an ultrasound is better for certain things, an MRI is better for other things, more soft tissue things. A CT scan is much better for bony things like bony changes. So if you are suspecting like metastasis of cancer to the lumbar spine, the proper test would be a PET scan and a CT scan. If you're suspecting metastasis to the liver, the proper test would be an MRI or an ultrasound. An MRI would show it better though. If you're suspecting gallstones, the proper test is an ultrasound. If you want to measure a mass in your breast with using the least amount of invasiveness, then you'd pick an ultrasound. If you want to look for metastasis of a breast cancer, if you're suspecting bony metastasis, again, PET scan and a CT scan. If you're suspecting soft tissue metastasis, or in the lung, a more proper test would be an MRI. Notice I didn't say X-ray on any of those things. That's what it would have been, 35 years ago. But since they've perfected an MRI and CT scan and PET scan, those have trumped that. Thank you. I will look at that. Alkaline phosphatase. Hold on. While I have you on the line. Oh. Okay, while that downloads. Oh. All right. Uh, let me see. Um, Sorry, it downloaded really weird on my phone. So, okay, so yeah, your alkaline phosphatase is going up a little bit. Hold on, really quick. Let me look at something else. Um, so always with a rise in alkaline phosphatase. Did they say anything about? So I asked her this question about the alkaline phosphatase, still within normal limits. Did they do any other testing to look for any possible metastasis? So if it was me, if I was your oncologist, I may want to I would possibly suggest a PET scan. Um, if they did a PET scan recently, when was your last PET scan? That would be my question. Again, you're still within normal limits. Certainly, alkaline phosphatase can rise. So let's talk about that. What can cause alkaline phosphatase to rise? Congestion of the liver is the first thing that you think of with elevated alkaline phosphatase. Um, so someone who does not have a diagnosis of cancer, you think of congestion of the liver. Taking NSAIDs, so Tylenol, Advil can cause elevation of alkaline phosphatase. Taking other medication can cause elevation of alkaline phosphatase because it's irritant to the liver. So those are your first things that you look at. With a diagnosis of cancer, the other thing that can cause elevated alkaline phosphatase is bony metastasis. So if there's metastasis to any bone that's causing lytic metastasis, will cause elevation in alkaline phosphatase. So that's a differential diagnosis that you want to rule out. What's going on with my liver? Typically, if I have metastasis to my liver from cancer, that's not necessarily going to cause elevated alkaline phosphatase. It's congestion of the liver due to a medication, usually, or some sort of toxic exposure can cause it as well. Um, that's what you're looking at. So, differential diagnosis, elevated alkaline phos is um, toxification to the liver through something, or if the person has a diagnosis of cancer, if there's any bony metastasis. Those are the things that should be ruled out. Again, your alkaline phos is still within normal limits. So, but still, if I was your oncologist, I'd at least suggest, should we do a PET scan? Actually, prior to my visit in August of 21, I was taking homocysteine resist. So homocysteine resist, and there's other products, different names like that, um, are mixtures of folate. This is methyl tetrahydrofolate, I'm sure, in this product, and 1,000 milligrams of methylcobalamin. So that would be the right thing to take. So um, I get pretty anxious with all of the challenges we're facing, despite trying to keep a positive mindset. Fear takes over. I know we can't heal in a state of fear. Considering getting a script for THC from our concierge GP. Well, I'm all in favor of that. So THC can be very calming just to take before you go to bed to help you get a good night's sleep. Because if you have anxiety that has your mind racing while you sleep, then you're just not getting good sleep. So I think that's a winner there. Take some THC before you go to bed would be really, really good. I don't think there's any issues with your breast cancer with that. Don't use, you could use labs. Labs goes right to the same info at Connor's Clinic. So labs at Connor's Clinic, you could use that one too. Yep, it's just another name for the same email. Is B negative blood type a concern if you decide to have surgery? I'm worried about that and getting vaccinated blood if needed. Yeah, I would, there's always a concern by getting vaccinated blood. I totally hear you on that. Absolutely. And I don't know, depending on where you go, that you could ask for, proof of that it's unvaccinated. I just don't know right now the state of the medical profession with that whole thing. Yeah, that's tough. Haven't had a scan, so this is answering this alkaline phosphatase questions. Since April 1st, don't have an oncologist, have been taking Tylenol, 500 milligrams twice a day. That certainly could be the rise in alkaline phosphatase right there. So if you could change off of that to go back to like a THC product, which now you could just order THC off the internet anywhere these days. So if you could get off of the NSAIDs, I would highly suspect that that's the problem. Also, I'm not sure if I'm detoxing my liver because I haven't done any enemas or castor oil packs, just supplements and rife. I also take 3 different blood pressure pills that I started in November. Oh yes, well, that could all be an issue. If you do start, just not trying to sell you on coffee enemas, but that's why you do coffee enemas, is it helps detoxify your liver because it stimulates parasympathetics. And what do your parasympathetics do when they're stimulated? But they are calming. They could help take care of some anxiety. They could help stimulate an immune response. They help with your detoxification pathways. And go back to this question back here about having anxiety and dealing with a positive mindset. Doing coffee enemas can just be calming because it stimulates your parasympathetics. And from a neurological standpoint, your parasympathetics are the antithesis of your sympathetics, which are your fight or flight, aka anxiety nervous system. So your parasympathetics are your anti-anxiety nervous system. So from a neurological standpoint, coffee enemas, whether a person has cancer or not, if you have anxiety, coffee enemas are right for you. If you have high blood pressure, coffee enemas are right for you. What is high blood pressure? So high blood pressure is contraction of the smooth muscles that is right underneath the endothelial lining of your blood vessels. What are they controlled by? Your sympathetics. So what could you stimulate to decrease your blood pressure? Quiz of the day. Ding, 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 ding. Your parasympathetics. Yes. 50 points for you. If you do a coffee enema, you will most likely lower your blood pressure, lower your anxiety, increase your detoxification pathways. And coffee enemas are so good for stimulating your immune system and just calming you and getting rid of anxiety. So 500 points for coffee enemas. Coffee enemas win the quiz bowl of the day. Sorry, I'm a little weird. But, all right. Thanks, you guys. It's been over an hour. I'm going to announce next week when I get back in the office what day. So you guys, if you guys have a specific day, a bunch of people already sent in, the consensus now is Mondays based upon what you already sent in. And it's going to probably be Monday evening that we do our protocol and lab work Zoom call. So if you think otherwise, make sure you get that in as well. Thanks everybody for being on. I love you all. I'll be praying for you all. And great, Monday sounds good to you too. Fantastic. And we will talk to you next week. Bye-bye.